Our next speaker is a surgeon, a lecturer and a clinical entrepreneur. Drawing on her passion for innovation, education and surgery, she's the founder of Proximie, an augmented reality platform that enables clinicians to virtually scrub in to a clinical setting from anywhere in the world. So the aim is to improve access to expert care and scale clinical expertise globally. So we're delighted to welcome Nadine Hachach-Haram. Nadine, welcome, and over to you.
Thank you very much. It's a pleasure to be here, and it's been great to see the speakers so far this morning in the lineup. As you kindly introduced, my name is Nadine Hachach-Haram, and I am a surgeon and entrepreneur as well. It's always important, I guess, when we talk about the why of how we sort of move through things, that we should have shared the original story and where things started. And in my case, it really started with my grandmother. As I started as a young child growing up in Beirut, I recognized the challenges of access to healthcare firsthand. And through my time growing up there and recognizing that people lacked access to the same quality of care all around the world, my grandma started to influence my thinking. She committed her life to impact and improving the quality of people's lives, and told me it's really important to try and think about, what legacy do you want to leave and how do you want to live your life? And having grown up in Beirut and seen those disparities in healthcare, it was important to me to make sure that I committed to my life to helping patients get a better quality, restore form and function, and hopefully better access to care. And so during my time, I trained as a reconstructive plastic surgeon, and I'm a consultant at Guy's and St. Thomas's and the head of innovation there. But it also became clear to me as I was training and in surgery that we have really a fundamental challenge in the world today. 5 billion people still lack access to safe surgery. 18.6 million people are dying due to lack of access to that basic surgery. And more importantly, this is a problem everywhere, not just somewhere. This often misconception that lack of access to surgery is only siloed to LMICs or the global south is wrong. And having worked in the NHS myself and worked in other parts of the world, I've seen that firsthand. But I think if we take a step back and just think more broadly about what are the transactions of innovation in healthcare that are trying to influence surgery, that are trying perhaps to solve this challenge and solve this problem and bridge that gap, we've seen a whole host of exciting innovations that have come out around visualization with augmented reality and virtual reality, precision data with genomics and big data, but also looking at other components like computer vision, AI, machine learning, and robotics. What's also important ultimately when we think about the transaction of innovation in healthcare is how do we measure value? And as a clinician working firsthand, it was very important to me to make sure that we weren't just exploring the opportunities of technology for the sake of technology, but actually that this was providing value to our patients, either improving outcome, reducing cost, or ideally doing both. And if we take a step back and look at surgery, sadly, it hasn't really changed very much for many, many decades. The genesis of surgery was very much born on this idea of communication, collaboration, and co-presence. And for a time, this made a lot of sense, the ability to push each other, to drive that change. And I think it's why many of us chose surgery, that idea of camaraderie and communication, collaboration amongst the team. But when we look at that sort of translation and evolution over time, it hasn't really changed, as I've mentioned. And this is a picture from some years ago, but again, it demonstrates the problem, I think, at pace. You see a lot of people crowded around an operating table, trying to understand and see the operations that are happening. And then each of them, through their own perception and interpretation of it, taking that technique and going and applying it in their own healthcare practice. And that, of course, is going to induce a lot of variation, and to some extent make sure that there's going to be a lag in the skill acquisition and the delivery of these techniques. And I appreciate that this picture is a bit facetious, but it is a true picture. And I can say that even in my OR at any one time, I've had 10 to 15 people around the table. And so when we look at that transaction, what we try to do is, how do we try and change the paradigm? How do we try and make this accessible, democratized, digitized, and data-centered? How do we create a world where operating rooms all around the world are connected, collaborative, accessible? And that's what Proximie is. It's a software platform that allows you to virtually scrub into any operating room or cath lab anywhere in the world, to collaborate in real time, to share best practices, and to ultimately hope that patients get the best care the first time, every time. More importantly, every procedure is then recorded, analyzed, and leveraged for the future. So you can start to crowdsource and build this rich repository of information and data that hopefully can continue to influence and optimize clinical care and reduce the high amount of variation that we see in surgical care today. And the next video, I hope, will demonstrate some of the analogies that we see in sports. Many of you probably are aware of Atul Gawande, and a few years ago, he published an article in the New Yorker that talked about surgical coaching and collaboration. And we really truly see surgery and that paradigm shift trying to learn from other sectors, such as the aviation sector, and in this case, from the sports sector. And so if we can play this video, I hope it'll demonstrate that analogy.
Technology is changing our pursuit. Just look at the world of sport, the pre-game plan, the post-game review. Every angle, every possibility, watched, reviewed, applied. What about the clinical world? At Proximie, we enable clinicians to virtually scrub in and collaborate with each other from anywhere in the world, allowing any clinician to prepare, perform, and perfect their craft. Pre, during, after. Think of us as your game tape. Start your pursuit today. Plug in Proximie. Connect clinicians. Save lives.
And so going back to that point about value, we deliver these things with value to standardize care and reduce variation, to ultimately save lives and improve the quality of lives of patients. We work with you and with partners to redistribute clinical talent, to drive expertise and reduce variation, to optimize efficiency and cost effectiveness, and ultimately to scale trains acquisition, accreditation, and the delivery of new techniques and new devices to patients. And we're helping organizations differentiate their offering and stay ahead and show that they are innovative in adopting this new digital world. And with everything, and as a clinician myself, it's important that we actually back what we're saying with evidence. And we have already demonstrated that we can train twice as many surgeons in half the time and maintain quality of care. And we continue to publish and have published multiple articles in peer-reviewed journals around this. But at the end of the day, of course, it's about people. And surgery affects all of us, whether you're a patient, a relative of a patient, a colleague, brother, sister, mother, father, it affects us. At any one time, you may have anywhere from, seven procedures in your lifetime. And so that's the average number that the US is scoring at the moment. And so for us, it's important that we make sure that the voices of these people are heard and we're able to help them and scale their expertise as well. And it is through this campaign that we drove the Voices of the OR campaign, and we'll play this video, which enables us to capture those voices and amplify those voices in how we collaborate and drive expertise for patient care.
I think this technology works brilliantly. The fact that I can see you perfectly, I can hear you perfectly, and I'm literally in the middle of fracture clinic on an NHS Wi-Fi on my ordinary laptop.
Imagine capturing every voice, every annotation, every video, and being able to crowdsource all that rich knowledge and data to change really the face of surgery. And I hope this video will demonstrate how the technology is already doing that.
We're in Australia, Melbourne, Australia, and we have 69 different countries, so it's such an honor, and thank you, Proximie.
So Marcelo drew out the bubble. You can see the discoloration all along there.
That's really neat. That's cool, isn't it?
Claudia, are you happy with that? Or?
Yes, I'm really happy because you see it's not too much anti-erosion, and that is probably one of the main problems.
We can hear you. Everything looks very beautiful. Sounds beautiful as well.
Very, very nicely done. Very smooth.
Thank you, Mark, and enjoy your theater day today.
Thank you so much. I have to run off to the OR myself, and I'm going to go try this.
Here's the pancreas.
Ah, yeah, just a little wink of it.
It's our friend.
Yeah.
I always say the pancreas is our friend because it always gets such bad press in the colorectal world.
And I hope what you can see already from that video and what I've mentioned so far is that a siloed approach is not going to solve a systems problem. And what we need really to do is build a connectivity of operating rooms, expertise across the multidisciplinary spectrum of surgery, from scrub nurses and scrub techs, junior trainees, medical students, surgeons, assistants, all working through that, trying to change the paradigm and digitize the OR. And ultimately, we need to recognize, of course, the many hours and the many efforts to deliver that care to patients. And ultimately, what we're all trying to do is trying to improve care for patients.
The hours. Absorbing, watching, practicing, perfecting. Always learning, understanding and improving. Surgery doesn't stop when you leave the operating room. It's there to be shared, discussed, and explored. The hours, they define us. To the next generation, the early adopters, the new breed. Here's to the pursuit of perfection. Prepare, perform, perfect. You are the hours you put in. Join us on Proximie.
And together with surgeons all around the world, we're capturing, cataloging, and helping drive a new OS version of the OR. Because ultimately, we can no longer accept today that 5 billion people lack access to safe surgery, and then 18.6 million people are dying because of lack of access to that surgery. And as a final note, I'd love to leave you with a story. This is a story of a 6-year-old patient who unfortunately suffered complications following a perforated ulcer in her stomach. She had a laparotomy, she was admitted to hospital and intensive care, in and out for many months, and almost died twice. Subsequently, she was fed for a year with a PEG tube, and at some point was really thinking, what was this quality of life? Eventually things healed, but she was left with a really difficult hernia that kept her in and out of hospital every few months. And she reached out to us pretty desperate, saying, I've got a great surgeon locally, I trust him, but this is quite a complicated case, and I don't want to leave my home environment, my family, my support structure. Can we use Proximie to bring an expert from around the world to support my doctor to do my case? And so we obliged. And that surgeon worked with her surgeon for 6 hours to address all her adhesions and rectify the problem. She went home at day 5 and is now living her best life. And this patient is my mother. I want to thank you very much. There's obviously a lot more that one could talk about during this talk, but thank you for the opportunity, and I look forward to getting more questions during the Q&A session.
Nadine, thank you so much for that really great talk, and the family, bringing your own family into it was really powerful, I think. Thank you so much. Very inspiring. So we've got some questions coming in from the audience, but I'd love to ask you a couple, first of all, myself. Really, we're seeing, enormous kind of waiting lists in the NHS for elective surgery. Is there a way that, Proximie can help to mitigate this challenge that we face now in the UK healthcare system?
Absolutely, and it's a great question. And we've already, even during the COVID pandemic and since then have been playing, we believe an important role in helping connect expertise, drive access to the experts needed to deliver care to patients closer to home. And we've also been working at a more of a grassroots initiative where we're helping trainee students and medical students get accelerated and familiarized with techniques as we move forward. I think there's a question of the now, and the now is today we're connecting experts around the country, but there's also a question of the future. How are we going to actually address the workforce backlog, and how are we going to address this gap? And we need to think about technologies that are going to help us accelerate the delivery of training, acceleration of training, and helping deliver proficiency and effectiveness in our workforce. And that may extend beyond doctors themselves. It may be clinical nurse specialists. It may be other healthcare workers within the sphere that are going to play a role in shaping and driving a closure to that gap as much as possible.
And I'm curious to ask you about the idea of connectivity. Clearly, Proximie depends on this kind of connectivity that we need. How do you work with other players, so telcos, the space industry?
It's a great question. And, one of the key things for us up front was making sure that there was thoughtful design into the product platform. And we made sure that the design of the system would work on low bandwidth. And that was important because a few years ago when we designed this, we recognized this high amount of heterogeneity in terms of access to connectivity. That being said, we're seeing a huge proliferation of new opportunities and technologies that are going to help bridge that accessibility and kind of, bandwidth equity in the world. We've had a lot of interesting discussions around the sort of potential with, low orbiting satellites and discussions around what does that connectivity, play and the role it can play in global health as well. And I think we'll start to see opportunities where 5G can play a critical role. And we've had a lot of interest from multiple telco players around potential partnership in this space as well.
Great, thank you for that. We've got questions coming in from the audience, and we're a little short of time, so I'll just ask one, if that's okay, the one that's got sort of voted up the highest. So are there any limits to the types of procedures that you're able to, or surgeons are able to perform using Proximie?
It's a great question. Actually, we're able to perform every kind of procedure. We've really stress tested this across all specialties. And I would even go beyond just the operating room. I mean, this is about connected surgical care, which starts outside the operating room and finishes outside the operating room. So it's pre, intra, and post. So we're already doing things like, pre-op assessment of, fractures, hand trauma clinics. Mm-hmm. We're looking at wound care in the community. How do we start to help our wound care nurses out in the community to accelerate treatment, time to treatment, et cetera, et cetera. So it's pretty broad-based. And as a small company, of course, we started to focus on a few key specialties when we started, but we're really starting to see that expand rapidly.
Great. Thank you so much, Nadine. Really, really enjoyed the talk. Thank you for joining Wired.
No worries. Thank you very much.